Dear friends, I hope you've all had a wonderful week, that you're healthy and feeling good, and that JBS has been keeping you good company. I'm Mark Golub. There's a little more reason to be optimistic today as we prepare to celebrate and do celebrate this Shabbat. The good news? The curve has flattened. There have been no massive spikes in the states that have already ended the lockdown. In fact, in states like Florida and Georgia, there's been a decline in confirmed cases and in deaths. I hope you've all seen there's a highly respected study this week that tells us the virus is not as communicable as experts once thought it was. The CDC is now saying the virus is communicated mainly from face-to-face contact, person to person, not by touching surfaces. Johns Hopkins has found that the way people contract the virus is from direct contact with infected people, and it's unlikely that one can get the virus from a contaminated surface like a grocery bag, or an Amazon delivery, or a doorknob. And how nice is that to learn? Moreover, it seems that it's not so much how close we come to someone with the virus, but for how long we stay close to someone with the virus. It's now believed that one needs to be in close contact with someone with the disease for a good amount of time if there's a risk of infection, which is why healthcare workers who are working with COVID-19 patients for long periods of time, they are at greater risk and they have a greater rate of infection themselves. But it seems very unlikely one will contract the virus simply walking around outside, even if one passes by where someone with the virus has already walked. It's also why people do not seem to be getting the virus when they shop at a grocery store or at a pharmacy, or visit a park, or a beach, or take a walk or a run, or a bike ride outdoors. Because we're not in contact with other people for any significant length of time, which has to be at least 15 minutes or more. That's very different than sitting in an enclosed room with the same people for a good deal of time, longer than 15 minutes, even an hour or 2 hours. And while studies show that for people over 25, COVID-19 is more deadly than the flu. Studies also show that for people under the age of 25, the flu is 1.3 times more deadly than COVID-19. And it also looks very much like children are almost at no risk at all of contracting the disease. And we may be reopening schools this fall after all. In Israel, for example, which has been extremely successful in limiting the spread of the virus, and it's had an extremely low death rate, schools have reopened throughout the country with children wearing masks. Sweden, by the way, is now being cited as a model regarding children. Sweden never closed its schools and still has one of the lowest pediatric infection rates among the industrialized nations of the world, and has had only one child die of COVID-19. In Denmark, Danish bars and cafes are functioning normally. Social distancing has been reduced in Denmark from 6 feet to 3 feet. Face masks in Denmark are not compulsory, and most people are not wearing a mask. And there's no increase in cases. So all 50 states in America have now begun to reopen society to one degree or another. And some states are considering reopening schools and even camps. And in New York, Governor Cuomo seems ready to permit houses of worship to reopen with strict distancing guidelines. It'll be interesting for us to see what Central Synagogue and the Hampton Synagogue will be doing in the coming weeks. Many of us didn't see this coming. Many of us thought it would take much longer to begin ending the lockdown. And of course, there are those saying we're ending the lockdown too soon and that there'll be a spike in cases and we'll all be very sorry. But the evidence at this moment seems to be saying the contrary. Of course, there will be some who will now contract the virus, and some may die. But the real concern that forced the lockdown was that our hospitals and healthcare systems would be overrun and would be unable to care for those who fell ill. And that's not been the case. So even if some people do need to be hospitalized, our healthcare system does not seem to be in jeopardy of being overrun. And if that's true, ending the lockdown now makes perfect sense in terms of public policy. At the same time, for those who predicted that Israel will lead the way in fighting the virus, Forbes magazine reports that Israel's Institute for Biological Research, IIBR, has effectively isolated the antibody that neutralizes COVID-19 and is planning to do experiments on animals in the very near future. The IIBR is also doing promising work on a COVID-19 vaccine. And it's not only in Israel. The University of Oxford in England has developed a promising coronavirus vaccine which will be mass-produced by the drug maker AstraZeneca, which is partnering with America and has received a $1.2 billion grant to help their work from the United States. Also here in America, Johnson & Johnson is working on a COVID-19 vaccine it hopes to have in human clinical studies by this September. Now, what does that mean for us? For the many of us? For me, and for those of you in the JBS viewing family? But who am I to be expressing any opinion about a health issue? I'm just like one of you. The fact that I'm on television bestows upon me no special expertise, certainly no special medical expertise or wisdom. Well, that's true for everyone you see on television, whether it's CNN or MSNBC or Fox or PBS, ABC, CBS, whatever other channel you watch when you're not watching JBS. It's simply childish to think that TV anchors are wiser than you are. So I'm not offering any advice. But I can tell you what all this means for my wife and for me. We are encouraged. We're even a little less anxious. But we're not changing anything we are doing or not doing. We're staying away from anyone and everyone when we need to leave the house, which we're doing as infrequently as possible. We do take drives in the car, by the way, on bright, sunny days. I love bright sunny days. They make me feel better. So we'll drive to the beach or the park. And if we leave the car, if anyone is anywhere near, anywhere around, we'll be wearing masks. And we'll stay away from everyone. And we continue to wipe everything down with disinfectant. And wash our hands anytime we enter our home, or if any package arrives. We are in the vulnerable demographic. We will not risk contracting this virus, even if it's an unlikely possibility. And while I'm not telling any of you how you should deal with the reopening of society, I am saying that I am definitely encouraged by much of what I am hearing about the slowdown of cases and of deaths, that hospitals are now free to perform all kinds of other surgeries and medical procedures, that states which once were ridiculed for opening have all proven their critics wrong, especially the state of Florida. And it's all anxiety lifting to learn that as deadly as the virus can be to those over 70, especially with pre-existing conditions, it's much harder to contract the disease than originally thought, and it's highly unlikely we can get the disease from a surface, like a countertop or a package. Not that there's no chance, but there's very little chance. Just as there's very little chance of contracting the virus from another person unless one is in close proximity of that person for 15 minutes or more. So all this news is positive. We're clearly moving in the right direction. And while this may make no difference in the lives of those of us in the more vulnerable demographic, this does mean that society may begin to function, on some level at least. And most important of all, the economy can be restarted again, which is crucial to the quality of life in America and for people throughout the world. So for Shabbat, isn't it all lovely? And for Shabbat, we have some simchas we'd like to celebrate with you. First, a Mazal Tov from Nina Yoshbi to Lisa Maginot Follette, who graduated PCOM Medical School this past Tuesday, May 19th. Congratulations, Lisa. And a Mazal Tov to Joel Samuels for being awarded a master's degree in business from Columbia University this past Wednesday, May 20th. Congratulations, Joel. And then Edith Sammers and Ed Smith have two simchas in their family, one for a granddaughter and one for a grandson. First, a Mazal Tov to Rebecca Glicksman, daughter of Audrey and David, on Rebecca's 18th birthday and her graduation from the Leffel High School in White Plains this past Monday, May 18th. Congratulations, Rebecca. And on Memorial Day, May 25th, a Mazal Tov to Brian Sammers, son of Bill and Robin, who will be celebrating a bar mitzvah. Congratulations, Brian. And if you have a simcha, or if there's someone you'd like to include in a Misha Berach list to express your care and concern for someone who's ill, or if there's a yortzeit and you have no synagogue setting in which that name will be read, please send me the information, and I'll be honored to read your simcha or your Misha Berach or your yortzeit here on JBS. Just email your information to jbscommunity@jbstv.org. And to be in touch with me directly, email me at rabbigolub@jbstv.org. Here are the rough coronavirus numbers as of last night, May 21st. In the United States, there are now more than 1.6 million diagnosed cases of the coronavirus. But the death rate has fallen under 6% and is now down to 4.2%. Again, still a serious death rate, but a sign of real progress. While the rate of recovery in the United States is up another 2% over last week and is now at 23%. Meanwhile, in Israel, there were only 116 new diagnosed cases in the past week and only 15 deaths. The fatality rate in Israel remains under 2%, while the recovery rate has jumped another 10% and is now at 82%. So Israel continues to do so very well. And so until the next time, I'm Mark Golub. Shabbat Shalom, and stay safe and be well, my friends.